Welcome to the NorthLakes podcast. I'm your host, Jeremy Oswald. I work in the marketing department at NorthLakes Community Clinic, where I put this podcast together. Today, we talk about a subject that is a relatively new one to the world, long COVID. I say new because everything COVID is only a couple years old. Tamilyn White is one of my coworkers who has long COVID, and we're going to learn more about it right now.
Okay, well, my name is Tamilyn White. I am a behavioral health therapist here at NorthLakes. I've been with NorthLakes since 2015.
And we're here in the Hayward clinic.
And we are here in the Hayward clinic,
And
yes.
I forget, are you just here or do you go anywhere else?
Nope, I'm just here now.
And that's plenty.
No. Well, when I started, I was in Hayward, I think it was 2 days, and I was in Minong 2 days, and then I was in Iron River 1 day. So I did lots of traveling. But it was good because I got to meet lots of people,
Yeah.
right? Got to know people all over NorthLakes.
And I love that we knew each other. We've known each other for a while, but I haven't seen each other, so it's really nice to see you.
Oh, yeah, nice to see you too.
And thanks for doing this. And what we're talking about today, and I like, this is all kind of a new subject for me, and it's long COVID, and it's something you have. And
yes.
I like to make sure I'm using all the right words all the time and everything. Is that what it's called? Is that what you refer to it as?
That's what they're calling it. Mm-hmm. Well, yes, when I'm talking nicely about it, that's what I refer to it as, long COVID or long haul COVID.
Okay.
Yep.
And so what happened? Like, kind of give us the, like, why are we in the same room today talking about this today?
I'm not coughing on you. Don't worry.
No, we're both masked up, and if I had a shield, I'd put it up.
And we've got 6 feet here.
Yeah. I think
A
so.
Full adult cow in between us.
Yes,
we're
exactly.
Good. Right. So how we came about to do the podcast today?
No, not that. I'm more like, what happened to you? Like, what's going on? Like, give us the story of your long COVID experience.
Okay, well, it starts like beginning of COVID, I think, because like back in like late December, early January of 2020, right, when we first started hearing news about this new virus, right? Like, I'm kind of a medical geek, should have been a doctor, am not a doctor, right? But kind of a medical geek. And so I was like, that's really, like, how fascinating, a new virus. What is this even going to do, right? And then it started getting bad, and people started dying, and we started hearing about all these people dying, and then it was spreading. So I was, like, crazy vigilant about, number one, about keeping up with how it was spreading and what was happening, but then also, like, anything that I heard about people who could prevent it or who were able to live through COVID, that kind of stuff, like really paying a lot of attention to it. Just the medical geek in me doing that. And also I work in a medical clinic, right? So there are people coming in and out all day long with all kinds of stuff. And I've always been a pretty healthy person, so it wasn't anything that I was ever super worried about for myself. But I wanted to know, like, what can I do to help keep my clients safe as I'm meeting with them, and what can I do to promote health and safety out in the community and that kind of stuff. So really have been paying a lot of attention to COVID. And as the site manager here will tell you, I got hypervigilant about my own symptoms. And so, like we all agreed to do.
Which was the right thing. Yeah. Right? That's right. What we all agreed to, and that's what kept a lot of us safe.
Right. And as you know, every time we open our computers, there's a little notice from NorthLakes saying, when I log into NorthLakes, I verify that I don't have these symptoms and that I'm feeling healthy and that kind of stuff. And even though a lot of the work that I was doing for a while was at home also, where I was meeting with people virtually and stuff, I still see that every single time I turn my computer on. And so I cannot even tell you how many times poor Karen Blaney got a call from me or a message from me like, I have a sore throat. I don't know. Do you want me to come in? Do you not want me to come in? And it was very much like there were some times where like 2 symptoms, nope, you stay home. And then the next day or a couple days later, I'd be fine. And I never got really sick. I managed to stay pretty healthy and washing my hands all the time and wearing my mask and not going near crowds and all that kind of stuff. Like super attentive to that kind of stuff. And then in January, probably January 15th, I went to Madison.
This is 2021. So
This is actually 2022 actually. Like
okay,
fast forward, like jump forward some years. I've managed to stay healthy, right?
Yep.
Even though people around me are sick and clients have been sick and that kind of stuff, and people in our community are dying, right? This is nothing to mess with. This virus. But in January, like mid-January of this year, 2022, I was in Madison for, I guess, a relatively public event because it was to meet with the University of Madison for like a prospective student thing, taking my stepdaughter down to Madison and go through the tours and all that kind of stuff. Masked up, kept social distance, washed my hands. Like my hands were chapped. I washed them so much when we were in Madison. And I connected with my son who was in Whitewater working on an athletic training internship, right? So I spent like 45 minutes in the car with him and just talking and not masked. But just out of, I don't know what, sheer exuberance of seeing him after not seeing him for a couple months, right?
Well, isn't it weird? Like, I'm not going to say that, like, personally, and I don't, like, maybe not speaking for NorthLakes, I feel like everyone's kind of had to go on this journey on their own.
Yeah.
You know, and isn't it weird to be, like, you're, like, admitting, like, something, but do you feel like you're admitting something bad, you know? Like, and I don't mean to put you in that position, but isn't that, like, is that how you feel?
Yeah, that's exactly how I feel. Like, oh, and I've been so careful about this, and then I didn't mask. Oh my goodness, the shame, the humiliation. I didn't mask for 45 minutes with my son in a vehicle. Mm-hmm. That's exactly how it feels, or how it felt. I'm kind of over it now.
Okay, good.
Right. Can't carry guilt that long.
Yeah, no. We won't like the beauty of you being a behavioral health therapist. Right. I'll exploit that maybe later in the conversation when I need some help.
Oh, but let it go.
Okay, right? Okay. I'm sorry to interrupt. Keep going.
That's all right. That's absolutely all right. So, like, had a great time with him. Madison was great. Stepdaughter decided she's going to Madison. She is now going to Madison. And then Monday, I came and I did a full day in clinic, saw clients all day long. I had a couple clients who weren't feeling the greatest. Didn't really think anything of it because we were masked. I washed my hands. I sterilized everything, as I've been doing for the last 2.5 years, right? After every client that I've seen in the office. Tuesday morning, I woke up kind of with a sore throat, kind of with stuffiness, and then I was like, oh, okay, and I got a little tiny bit of a headache that I better let Karen know, right? right. So I sent her a text, Tamilyn. And like, it's exactly it. That's exactly it. I'm sure she was just like rolled her eyes and, oh, not another one. Right? But I sent her that, and she's like, all right, we'll transfer everything so that you'll be working from home. You'll just do virtual today. We'll switch all your clients over to virtual, which we did. I worked the whole day and kind of kept feeling worse as the day went on. So after my last client and I had started to feel pretty rotten, I had one of the at-home COVID tests, which I did. Those are not fun or pleasant, but I was like, I'm following this exactly to the T. I think I measured on the swab, like how far was however long you're supposed to insert it into your nostril. It felt like I was scratching the back of my eye, right? But I did everything by like set timers and everything exactly like it was supposed to. It came out negative. So I was like, all right, I've had colds before, right? I know how to do a cold. Just drink a lot, rest, I'll be fine. And then probably I would guess probably like 2 or 3 in the morning that morning, or that next morning, I woke up with the most intense pain in my head that I've ever experienced. And I've had migraines, right? It was like, I couldn't even tell you how much worse than a migraine that it was. It was so bad. It was the worst pain I've ever had anywhere. And I've given birth, right? It was worse than that. I would have gone to the emergency room if I thought for even a minute that I could stand up in order to walk down the hallway to the car and then tolerate the 3-minute drive it would take me to get to the hospital. I couldn't roll over. I couldn't blink. All I could do was just hold my head and like, this has to be over sometime. This has to be over sometime. The worst headache I've ever had. At some point the next day, I got to public health and I got tested. I really have no recognition of how that happened because I was so sick. And then spent the next 36, 38 hours sleeping. Just sleeping and moaning and like cursing my head. It was horrible. About the time that the headaches started lifting, the coughing set in, and my body, every part of my body hurt. Like when I finally talked to a doctor about it, she's like, "Well, does it feel like joint pain or muscle pain?" Okay, it feels like everything hurts. But about that same time, I got an email back from testing saying that I tested positive. So negative self-test, positive PCR test, the kind that goes to the lab and gets sent back a couple days later. I hadn't really been doing much up until that point because mostly I was sleeping. But then just went into complete isolation, locked myself back in the bedroom at the very farthest end of the house, away from where all the activity is, and then spent the next 2 weeks not interacting with any humans other than a couple phone calls. But I couldn't talk without getting breathless or without having these wicked coughing spells. So everything was by text if I was really doing any communications. And that, like, my family was bringing me food and like knock on the door, and then they'd go down the hallway, and then I open the door and pull it in, like some kind of refugee or something. I don't know. Or probably
prisoner.
Yeah, like a prisoner, right? A prisoner who's well taken care of.
Yeah,
but really,
right.
Definitely a prisoner to COVID. Totally a prisoner to COVID. I watched every single thing of even remote interest on virtually every streaming service available. I couldn't watch any more TV, and I don't usually watch a lot of TV, so it was grueling.
You got a lifetime supply in.
That's right.
And you were feeling, I mean, you had symptoms this whole time, and that headache and the cough, like it wasn't just like need to keep away, you were suffering.
There was never a point in that first month that I felt okay. There was never a point where something didn't hurt or where I wasn't a breath or two away from coughing.
Could you sleep?
Sort of. Sort of. It was sleeping in fits, but there was nothing else that I had to do, so that was good. But I did yoga because I'm pretty rabid about doing yoga, and I did yoga because it felt good to move. It felt good to do something. But yoga's all about breath work, and I would have to interrupt and cough and gasp for breath and like hold on to things and just breathe through it. So I did like these very mild yoga practices, still coughed, didn't matter. Still got out of breath, but it was, like I said, it was doing something. That wasn't watching TV. I read so many books. I did so much journaling. I ended up doing like writing COVID haiku. Right, I could send you some. It's very, very quality.
If you do, I would put a couple up on the website if they're not filthy.
Yeah, no, I mean most of them were like, "This is a wicked thing." Yes.
I would love to see some.
All right, I'll send you some haiku. Okay. Yeah. So I hadn't gotten better after a month, right? And poor Karen, I'm like, I still feel bad. Like she's gonna wave a magic wand and I would feel better.
I should just say Karen is the site manager here in Hayward.
Yes, she's the person that we report our symptoms to.
Yes.
Right? And who manages virtually everything else. So I'm sure she had other things to do than respond to my I still feel really terrible, and by saying you still need to stay home and take care of yourself.
Yeah. So, and I mean, are you testing yourself on a regular basis at this time to continue to see if you have it? Or
I'm not contagious anymore. The last time I took a COVID test actually was last week Monday, because I had a procedure scheduled for Friday. So at the end of that first month, when I was still feeling terrible, I was like, I can't do this, right? Like, I can't just keep saying, oh, well, I have COVID. I'll just keep laying here on into infinity, hoping that I get better. So I scheduled an appointment with the doctor. I was able to get in that same day because they'd started a new physician who now is my lifeline. But I went in and I met with her, and I like almost immediately started crying, and she's like, it's okay. We know how to at least make you feel better while we're doing this, right? We don't know much, but at least we can make you feel better about this. And like was talking to her about like, I'm a healthy person. This poor woman, I must have said that about 30 times, where she'd just be like, I know you're a healthy person, but you're not right now a healthy person. So she suggested that we do blood work and see if there's anything else that was going on that I hadn't known about prior that could be contributing to COVID and keeping COVID so active in my system. So I probably would have done anything she suggested at that point, right? Like if she would be like, we need your hand. We need to cut your hand off and test it. Right. I would have probably agreed. Right?
I'm glad it didn't come to that.
Me too. Me too. So when she was like, we're going to take some vials of blood, I was like, here's my veins.
Yeah, just dig in. Help yourself.
Exactly.
We just summarized a month or two of your life in just a few minutes here.
Yeah.
And I can't I'm going to just recognize that you suffered for a long time. And that's what it come to. It was probably very helpful, I would think, to finally be with somebody that might offer you some relief, and you broke down, it sounded like.
Oh, yeah, absolutely. Yeah. Just like, even just being in front of a medical person, and I grew up in surrounded by medical people. My grandmother was a nurse. My mom was an emergency room nurse. I used to, when I was little in the pre-COVID days, like ride the bus to the hospital, hang out in one of the treatment rooms in the emergency room while I was waiting for her, doing homework and that kind of stuff. Like the medical field is like my safe place.
It was a little bit of a homecoming, maybe.
Yeah,
uh-huh.
Yeah.
Uh-huh.
And so to have the doctor just be listening, I guess, and just like, it just felt like, oh, it's going to get better. Even though she's not saying anything is getting better, but just like, okay, so something's going to get better. I'm not going to be sick forever.
Safe space.
Yeah, safe space. Exactly. Exactly. So we did the blood test. Like, if somebody were to look at like who's accessed my chart records, like within the electronic medical system, if somebody were to look at it, they would think I was nuts, because there are like 30 logins in a single day, right? While I was waiting for results, because I was like, something has to show something, right? Because that all of a sudden became the focus. Like, one of these tests has to show something different than just COVID. Turns out they did, right? And the initial round of tests meant more tests, right? And so for a couple of weeks then, I was... I got to see Laura, Lab Laura. She used to be Lab Laura for us, and now she's Lab Laura for the Essentia Clinic,
okay,
right?
All right.
So I got to see Laura a couple times a week, right? Hey, are you feeling better? Right? Which veins do you want today?
It's always nice to have someone jamming things in your arm. I've had a similar, a friend of a friend. I was like, hey, oh good, it's you. Yeah. Go have at it.
Yeah, right? So, I trust you. Yeah. You can use my veins. Yeah. So I did that. Lots of testing showed that I had developed or exacerbated some kind of autoimmune response. And as far as I knew, right, I was a healthy person. I had no autoimmune issues. So then this doctor, who I still credit my sanity, right? Credit with my sanity. She's like, all right, well, here's what we're going to do then. I'm going to send you to some other people to test other systems, right? And we need to find out what is involved, what systems in your body are involved, so that we can even have an idea of where to go with treating this. June 15th is my last appointment. I have seen rheumatology, cardiology, pulmonology, what's the ear, nose, throat person?
Oh man, you're asking the wrong guy.
Yeah. Okay, the
Leave it
ear,
at that.
nose, throat
Yeah, right,
specialist.
Yeah. I'll dump that in later.
Yeah. Yeah. Seen this specialist.
Yes, right. Yeah, exactly. When you hear my voice that sounds like Tamilyn's, that'll be this moment.
Yeah. Yeah. And gastroenterology. Like, I've seen
Everybody.
almost everybody. I'm sure there's somebody out there, so let's shh.
Okay. All right. If you're listening to this and would like to have Tamilyn as a patient.
Right. Shh, stand in line.
Yes, right.
So as of right now today, we being this entire team of people that I have developed since January, like over the last 5 months, we have determined that it's one of 3 different relatively rare autoimmune conditions that may have been existing in my body prior to COVID, but that COVID activated and exacerbated. So figuring out, like I said, like which body systems are involved has been pretty important, because the treatment for each has varying amounts of urgency, right? And luckily it's not my heart and it's not my lungs, right? Which would be the two big things. Oh, neurology. I've also seen neurology.
Okay, excellent.
Right?
Add it to the list, yes.
Right. So the where I am with that now, I have yet to meet again with all these results with my primary doctor. And the last appointment that I had with rheumatology, the rheumatologist said, okay, now, so I want to see you again in July. And I was like, peculiar, right? Okay, because I'm trusting the medical field in this. And I went out to the rheumatology desk and said, oh, she wants to see me again in July. And they're like, oh, perfect. Now, we just want you to know that during the summer months, you can come directly to the clinic, but once the roads start getting icy again, you can absolutely do this virtually. And I was like, wait, what? Well, what? No, it's a follow-up. And they're like, oh, no, you're our patient now. We're going to be seeing you every 3 months. And
Right.
I had the same reaction you just did, where I was like,
Well,
isn't this charming?
that didn't come up in the room.
Oh, yeah. No, I'm like, okay, so I guess this is the way that this goes. I'm a healthy person with an autoimmune disorder that, yeah, it sort of floored me at that point.
And is the COVID at this point, not this point, but as you were going, maybe meeting with them, is COVID still happening with you? I mean, is there a moment you're like, I'm done with it, or like what? How does the long COVID like come into that? Other than it,
I really
seemed like
don't
it
know.
Activated this other thing.
Yeah,
in you.
it activated this other thing. I've felt better enough to be increasing my time at work, which is beautiful because I can't watch more TV.
And I mean,
right?
You walked in here, like I said, we haven't seen each other in a while. You look fine to me. Like for what?
Yeah.
Jeremy Oswald's diagnosis, provider 8.
Looks fine.
Yeah, but I mean,
Right.
you
Right.
seem like you have the usual bright eyes and
Yeah.
pep in your step that I've grown accustomed to.
Yeah, well, today's a good day. Yesterday was a scheduled in-clinic day, and I woke up in the morning and my head was pounding, and this has especially affected like very specific muscles, like these muscles in the top of my arms, the muscles across my neck and my shoulders, and the muscles like my thigh muscles. My one arm was hurting yesterday, but I was like, if I can brush my teeth, I'm fine. I can go to work, right? I don't do physical labor. And I got out of bed, and it took me minutes to stand up, which is becoming more and more familiar, I guess. But up until this whole thing started, I've been doing a lot of work with chronic pain and chronic pain patients, and up until COVID, my experience with chronic pain was that I've had some cervical spinal injuries that have resulted in chronic neck pain. I know what makes it worse. I know how to handle it when I have it. I know about how long it's going to bother me, and I can avoid or moderate the things that I know make it act up, right?
You managed it.
Yeah, absolutely. So I was like, oh yeah, I totally get chronic pain. I understand what you're going through, right? Because I have chronic pain in my neck.
I do it all the time.
Yeah. And then I got COVID. And then I've developed this autoimmune thing. And now it comes when it wants to. And when it's here, I have to do the things that it says I have to do. And sometimes that is sleep. And it's not like, oh, I'm a little tired. I think I'll finish this and I'll rest. It's like sleep. Bam, you're out. It's insane.
Wow.
I've never been a daytime napper. And I think yesterday in my office, I was sitting and like, I wasn't with a client, so that was good, right? But I was trying to do some paperwork stuff, and I just like all of a sudden came over me, and I had to put my head down and just for a couple minutes, but like really had to get into that sleep breathing rhythm and just let my whole system sort of decompress, and then I was okay. But it's so strange to be making that adjustment.
It's like you have this, I don't know, there's so many metaphors. Here's the one that came to my mind. It's like it's just this friend that shows up every once in a while. Not a friend. Something that shows up every once in a while, and you just got to deal with it.
Yeah, yeah.
Oh, man.
Right, or like that, I think it's Simon and Garfunkel, right? Hello, silence, or Hello, darkness, my old friend. It's like that.
Oh,
yeah.
Here you are again.
Exactly.
And it's not like you get to just close the door and ignore them.
Yeah, and I don't know them well enough to know how to really handle that, other than that I do understand lifestyle medicine. I'm almost done with my certification program there. Yay! But I understand all the lifestyle things that need to happen in order to keep a healthy balance, right? So I walk every day. Rain, snow, ice, feeling rotten. Other than really the first 3 weeks that I was very, very sick, I've walked every single day, right? And when I first left the house to walk, I got I live right by the hospital trails, right? And so I get into the hospital trails, walk all the hospital trails, and then I'm done, right? That's a walk for the day.
Yeah.
No, I couldn't make it very much past the trailhead. So it was walk out until I couldn't breathe anymore, slow my breathing down enough to be able to walk back home, right? And that was that was my reintroduction to movement, really. So now making sure that I'm at least walking every day. I was doing yoga every day prior to getting sick, and now the end of the days are really the worst because I'm exhausted.
Have you felt that this is I was specifically thinking it was a long COVID. It was its own thing. Is it a new field that have you, and I imagine you do your research,
do some research.
What are you finding? What have you read about it? Is it what are other people experiencing, or is there, it seems like it's a brand new field.
It's a brand new field. It's 2.5 years old. Thankfully, immunology and I think it's virology. I don't know, whatever the virus guys do.
You're looking at
Dr. Fauci, right?
Yeah.
That guy and the teams of people who do what he does. They understand the course of viruses, which is really handy. So they understand the mutations and they understand the process of that. We can't control that. We as humans, and they medical people who control viruses maybe, or who address viruses and ask them nicely to leave. Right. The medical exorcists.
Right. Nice. Hashtag.
Right. But it is new. It is absolutely new, which is exactly what this savior doctor of mine was telling me, that this is new. This is new. We don't know how long it lasts, and we don't know at what point, at least according to her, a month ago, which was the last time that I actually met with her, because it's been a whirlwind of other medical providers since then, was at some point, this will no longer be considered long COVID, and it will be given a completely different name, and the name will match like the symptoms, what's going on in your body, and this autoimmune thing that you have developed. So right now, I think in my medical records, it says long COVID.
Mm-hmm. But who knows what that's going to evolve into. And is it so other people who have been going through it, maybe they didn't have the autoimmune thing. It was, as you were saying, like it was a lung thing that. Yeah. So it's like, it's a lot of tentacles.
Yeah, I think so.
This is your tentacle, but like
yes.
Other people are experiencing other things.
Yeah.
Oh my. Okay.
I feel like. Do you remember that TV show? I think it may still be on, but I'm not sure. It's an improv show called Whose Line Is It Anyway? With Drew Carey.
Yes.
And Colin Mockery and that whole team of people.
Yes.
And they had every once in a while in this show, they would give people, I think it was Drew Carey, who was giving people points. And he would say, you get 1,000 points that don't count for anything. Uh-huh. That's what my experience of COVID feels like, right? Like, you get COVID, it's going to do what it wants to do. Have fun or don't. It doesn't matter because it's doing it anyway. Right?
Right. How have you dealt with that? I'm going to just call it a feeling of powerlessness. Maybe that's not the way you address it, but how have you dealt with it? Uh-huh. Absolutely.
It is like I have control over what I do, and I have control over how I interpret what's happening, but I don't have control over what's happening. All.
When that friend comes to visit.
Exactly. Okay. Exactly.
Uh-huh. Right.
Yeah, when COVID is like, today you rest. Uh-huh. Hey, okay, well, I have some things that I'd like to do. Can I?
So you've
and
had
COVID says maybe.
You are lucky enough you get to just kind of change your own life, like when you need, like not even when you need, well, when you need to.
Yeah, when I have to. I am eternally grateful that my employer is as understanding and as accommodating that NorthLakes has been able to do this with me. Mm-hmm. Because I know lots of people don't have that kind of relationship with their employers and don't have employers maybe who are as understanding of any of this, I think, as NorthLakes is. Because it's really scary. The day that our human resources person started using the phrase short-term disability, scared the hell out of me. I was like, no, I'm a healthy person. Mm-hmm. I'm healthy person.
I don't do that.
Yeah,
that's not my thing.
Yeah, uh-huh. Absolutely. And then she was like, I just really need to lay this out with you. You have a disability. You have an illness that is affecting every part of your life, and you can't work like you did. And it makes me tear up now. Yeah. Right? Just like you can't, right? We want you to. Mm-hmm. We want you to be able to, but honestly and realistically, you can't.
We need to adjust what's going on.
Exactly. Exactly. And it was horrifying. And unlike, I think, a lot of people who have tried to live through this COVID thing, and especially long haulers like myself, don't work in places that have that kind of safety net. And like, I know for myself, right, I'm in a 2-income household. We've been able to weather COVID or the pandemic fairly well, pretty unscathed, and we're really, really fortunate, right? Like, I know that that's privilege, and I recognize that I'm so fortunate to be working where I do, in the field that I do, with the company that I work with, and with the supports throughout NorthLakes that I have, because it's I can't even imagine what I can imagine exactly how scary it is to have somebody say, you can't do your job anymore.
Well, right? And as you're saying though, like, imagine if you, because of that, didn't know where you were going to live, or you couldn't pay for your car anymore, or food, et cetera, which...
Exactly.
Yeah.
Exactly.
Yes.
And here we are with a high school graduation on Friday. and someone from the family graduating on Friday, and all of the stuff for the graduation party has been in the works since about March, right? And in March, I was going back to work full time, and everything was okay. And then it wasn't, but we still have all of these plans that have to come through. And so, I mean, like anybody, right? When income in a household shrinks, so does the budget.
Yeah.
Right. So it's been some adjustment. It definitely has been some adjustment. And right now I have joined the battle that I never wanted to be in, trying to prove that this has turned, it sounds weird to me to be saying this, but trying to prove that this thing that has completely taken over my life is not just a passing thing, and that I'm no longer a healthy person, but that I'm a healthy person living with what's being considered a disability. And it's just a bizarre shift for me to have to be on the phone with our long-term disability company saying, I know it doesn't have this as a diagnosis yet. I know this doesn't show in my medical records, but I just saw these 4 people this week, and each one of them did tests that contribute to the ultimate diagnosis. I know it's not there yet. I don't want this either.
Yeah.
I don't want any of this either.
Yeah, I really don't want to be talking to you. I mean,
exactly.
So being a healthcare professional has had to have helped in some way, in that you know how to advocate for yourself.
Absolutely.
You kind of can speak the same language.
Mm-hmm. Well, and also growing up in the medical field, right, and feeling as comfortable as I do with medical providers, right? Like we said earlier, like it's my second home, right?
Yeah,
the medical field.
You've got no problem walking into a hospital. It's
no.
Like, yeah. Mm-hmm.
And I don't find the testing scary, and I don't get intimidated when all of these really long words that equal here, this is your new life, are thrown at me, right? It's a shock. It's daunting. But I also know that at some point the test will be done, and probably I will be collecting all of those results, even though they're all going into my chart, so they're all in a central location. And I'll be bringing that to my primary doctor and saying, we need to interpret this and figure out what's going on, because I can't live without a plan for how to manage my health indefinitely. We have to come up with a plan, because I can't personally, I can't with my family, and I can't with my employer just expect people to keep going, oh, whatever, we'll work it out.
Yeah.
I need to have a plan. And part of that is figuring out what this diagnosis is, because the diagnosis will definitely drive the course of treatment and help to structure how to handle when it flares, and how to keep it from completely disrupting not just my life, but my family's life and my clients' lives and my coworkers' lives.
Well, and also to make sure it doesn't get worse.
I'd like it to not get worse.
You know what I mean? Like that. It's
exactly.
Like what is a long-term, what happens next?
Right.
Like does it enter a new sorry, I don't want to.
Yeah, no, that's okay. Absolutely.
I'm sure you've thought of this, like what?
Yeah.
Because it's you, not me. But I mean, like, okay, what do we need to do to make sure it doesn't, become worse?
Right. And we don't know, is there such a thing as relapsing COVID?
Yeah.
Well, there's such a thing as people getting infected by COVID multiple times. Is that relapsing? Is it separate infections?
Or what does a new strain do to you? If it is a new, oh my gosh. Okay.
Yeah. So I've started doing things like going to the grocery store, and it feels like taking my life into my own hands, right? I go to the grocery store wearing a mask because now I have to protect myself. Whereas prior to getting COVID, I really felt strongly that masking was helping me to protect other people. And now become one of the people who needs people around me to wear masks. Right? And it's a shift. It's a very strange kind of mind-bending shift.
I bet. And I have those feelings, and I don't necessarily want to go down to the social aspects, which we feel like I'm right at the door of, but I'm going to steer it away from there. But I think we've all, as I said earlier, we all had to kind of take our own COVID journey. And,
right.
And like, for one thing, I also try to keep a mask on because I think of, now I have you in my mind. Like, it was arbitrary people, but I now it's like, hey, if I can help someone out this way, it's not a big deal for me to wear this. Mm-hmm. The other thing I'm curious about, and I don't know how it's affected you, is that you're a behavioral health therapist. So what has that been like? And are you able to, or do you try to, like, this sounds me being naive maybe, diagnose yourself? Do you, like, recognize your emotions, and, like, how is that factored in being a therapist?
Absolutely. Well, as any therapist knows, a therapist has to be backed by another good therapist, right? Mm-hmm. And so I personally have a therapist that I meet with who is wonderful and amazing, and has seen me through. Now, that's kind of an interesting term because we haven't really been in the same room very often in the last several months, but who has been with me and listened to me and helped me when I've been too internal to recognize, like, oh, this is anxiety, right? It's getting the best of you. Or, yeah, it sounds like you're going down the drain here. You need to claw back up, or what do we need to put in place so that you don't end up in the depths of despair, right? Because I think I sound pretty upbeat today, but there have been days where I've just, like, the disability day where I was just like, oh my, this is what? Right? Where it was a low day. It was a low day followed by a couple more low days.
And you got labeled in a way, you know what I mean? Like, you entered a new category. Yeah. Like, for me, it was turning 50. I'm like,
I've done that too.
You know what I mean, though? Like, it became that. There's no way I'm that person now.
Yeah.
And so you're that person now.
Right, exactly. Yeah, and you get your invitation to join the AARP about the same time that you get your first denial letter from disability. Oh, happy days. Right?
Well, that's like, we're at that age now. Like, it is weird. It's a shift.
Yeah. Well, and like, I come from a family that lives a long, long time, right? My grandma was 103 when she died, and she was swimming in Lake Superior until she was 100 years old, right? That was her last time swimming, was August of the year that she turned 100.
Wow.
Right? Wow. Uh-huh. So, like, I hit 50, and I was like, have a century. I got more time. Then I got COVID, right? And I go, do I? I mean, do I? Because I hope to be one of those people who's in my 90s telling the youngsters about, when we had the pandemic and I lived through COVID, right? But
gas only costs $4 a gallon.
Right. We still drove gas-powered vehicles.
Yeah, right. Oh, there you go. Right. Yeah. Right. Okay. I like your world.
Right. I think there's a lot of horses in it.
Yes,
and probably carriages.
Oh, right? Excellent. Awesome.
Yeah.
We're on Mackinac Island.
Yeah, there we go.
Okay.
That's right.
That's nice. You have a therapist. Mm-hmm. And no, that's fun. I guess doctors don't treat themselves either, so that makes tons of sense.
Right. And because it's hard to see from the inside. Like, it's hard to see the big picture all the time from the inside, right? And I'm lucky to be surrounded by therapists, right? Because I work with them. But also, like, within my family and within just my general world, surrounded by people who kind of get it and who are like, yeah, you're having a rough day, right? Like, I'm not going to take personally you're snapping at me just now. But they could. And okay, it's not all glorious, right? There have been times where, like, you need to take your sick self and go back to the bedroom because you're so snarling at us, right? And that's a hard reality to face, right? Like, this is affecting the way that I interact with people that I care about.
I mean, as much as you have community and people around you, this is still your your disease, your journey.
That's right. Absolutely.
Yeah.
Absolutely. And I'm in it, whether I want to be or not. Yeah.
Awesome. Well, thanks a lot.
Absolutely. Thank you. Thank you for your time. And I think for getting this experience out there so that people maybe don't feel so alone or so frustrated when all of a sudden the headaches come on and guess what? You can't do anything. Even if you're in the middle of something really, really important, all you can do is do the headache.
Well, what I like about this conversation, it seems my perceptions of COVID has been, you get it, like for me, if I was like, here's the COVID journey in my mind, if I was to get it, I'm going to get it. I'm out for a little while, bam, done, move on.
Oh, yeah, that was my COVID journey too before I got COVID.
Yeah, right. So,
Exactly.
I mean, it's just like for I'm like trying to wrap my head around, like, I mean, it's not just you. Mm-hmm. I mean, I saw there was an article, I think it was in the New York Times not too long ago, that talked about it, how there's a lot of people going on. And I'm just now stewing over that this is something that just isn't going to go away. This has changed our lives on this earth in another way that I hadn't thought of until just now. So thanks.
You're welcome.
Yeah. Yes. What's in your car?
In my car?
Mm-hmm.
I ride a bike.
You don't own a car.
I have a truck that sits mostly in the garage. So what's in it? There are masks. I have masks hung over the gear shifter. And I have jumper cables. And I have a couple of bike locks, because who knows when you need to go someplace to bike, right?
I know, yes.
Yeah.
Okay.
Yeah, that's what's in my car. It's a truck, and really it's a bike.
Excellent. I love it. What's on your bike right now?
Well, on my bike right now, I just put a new headlight on it.
Oh, nice.
I know. I'm hoping. See, pre-COVID, I rode my bike to work every day that was above 20 degrees and the ground wasn't covered with ice, right? Biked all the time, and I have biked to work now exactly once since I've returned post-COVID. It was good.
Good. Mm-hmm. Well, thanks so much for doing this. It's really good to see you. And I mean, you do look good.
Thank you.
You look like, I'm glad I would talk to you. I'm not saying I wouldn't have talked to you if we were having a bad day, but I'm glad it's nice to see you on a good day.
Yeah. Yesterday it might have been a little bit different. But...
All right.
Yeah.
Awesome. Well, thanks a lot.
Absolutely. Thank you.
So there you go. Nice conversation with behavioral health therapist and long COVID sufferer Tamilyn White. She works with people at our clinic in Hayward, and it was nice to talk to her. I hadn't seen her in a while. Make sure you check out a couple of her COVID haikus in the show notes. NorthLakes Community Clinic is a federally qualified health center located in the top half of Wisconsin in the United States of America. We have 13 locations in 10 different counties and offer an integrated array of quality services for anyone that would like or needs them. I'm Jeremy Oswald, your host, and I work in the marketing department at NorthLakes. You can reach us at 888-834-4551 and learn a lot more about us on our website at nlccwi.org. Thanks for listening.